So this is an 11-year-old quarter horse mare. She had a history of chronic lameness of about 2-year duration. She was used for trail riding, but she became quite severely lame at some point. The client decided to retire her. And once we had the machine up and running, he decided to bring her here and see if we could give her some more answers. So we did evaluate this mare. She was grade 4 out of 5 lame on this particular limb, the right front limb, and she had pain on the hoof testers on both front limbs. We did a PD block on this foot, and she became sound on this foot and went lame on the opposite foot. So we CT'd her and found that quite extensive, I hope everybody can see my cursor. I found quite extensive mineralization in the area of the insertion of the deep digital flexor tendon. The area was quite wide, as we can see in this axial view, and quite long, as you can see on the sagittal view. The lesion extended from the level of the navicular bone down almost to the insertion of the deep on the coffin bone. We also noticed some mineralization at the area of the impart ligament. So it's, although we know that some mineralization can be of questionable clinical significance, this horse had a pretty severe and extensive mineralization, as you can see. I'm gonna repeat this video so you can see on the frontal projection. If you pay attention to the palmar aspect of P3, I'm gonna pause right there. You'll see some mineralization. It's hard first to tell here what is part of the deep, what is part of the impart ligament. But this horse also had some navicular bone changes. We'll go back, we'll see some sclerosis on the navicular bone, and those changes were bilateral. We treated this mare with mostly with shoeing. So we applied a rocker rail shoe on both front feet to easy breakover and help with the mechanics. And we started her on a cycle of pain medication. The client called us back a few weeks later, very happy and very excited because he had a sound pasture horse. He could even do some light riding, and so he was very satisfied.